That's a great question, and it's sometimes hard to answer. How long does ketamine last, right? Because every patient is so significantly different. What I'll say with our organization, we are one of the largest sole proprietor-owned organizations in the country. I feel like our protocols are very solid, and so when you ask how long does ketamine last, in our organization, after you finish those 6 treatments in about 2 weeks, which is kind of a standard, it's what all research was based off of using ketamine. After those 6 treatments, we do recommend that a patient do 1 infusion a month for 3 consecutive months following those 6, and those are called boosters. So it's 6 in about 2 to 3 weeks, followed by 1 a month for 3 months. And then after that, we recommend patients use ketamine, what we call PRN. PRN means as needed. So basically a patient will use ketamine however often they need it to keep their symptoms under control. That is going to vary greatly from patient to patient. I would say the average time for our patients following this series and those initial 3 boosters is going to be about every 2 to 3 months. But what I've found through about 5 years of experience and about 9 or 10,000 ketamine infusions, I find there to be great variance even among patient to patient. Not from the ones that sometimes it lasts a long time for, sometimes there are patients it doesn't last a long time for. What I say to that is typically patients respond so effectively. The efficacy for ketamine is about 80 to 84%. So in that 80 to 84%, what I find patients typically will do is sometimes get into a good season of life. Everything's going great. The relationship, the job, the parents, the dog, the friends, life just seems to be going really great. And sometimes I'll see patients go 6, 8, 10 months, maybe even a year without a booster. And then there will be an event, right? A stressful event. The job is not going so great. Maybe the relationship is a little rocky. Maybe the dog is sick. Maybe the parents are ill and getting older. At that point, sometimes I see that season is not so great, and I see patients using a little bit more frequent boosters. So maybe you're doing for a little while 1 a month. Maybe you're in a good season of life and you're going 10 or 12 months without one. I think that's going to vary greatly patient to patient depending on their season of life. But in general, after you finish the 6 infusions in 2 to 3 weeks and the 3 boosters at 1 month intervals, our typical percentage of time between infusions, or how long does it last for patients, it's going to be about every 2 to 3 months.